Hi, everybody. Thank you for having me, Tracy. Welcome to the next edition of the Low Carb Lifestyle Long Weekend. This is the fourth year of the Low Carb Lifestyle Long Weekend, and I'm so honored to be invited again. Fourth year in a row, and doing a talk this time on gut health and the gut microbiome. So again, thanks for having me. These are my handles if you'd like to follow me and my website. Just first of all, I would like to say that this is not individualized medical advice. If you decide to come here, then it will be. My clinic is Melbourne Low Carb Clinic in Wanchana. I do face-to-face consultations and telehealth consultations Australia-wide. So just quickly, let me introduce myself. I'm a GP. I have a family. I have 2 kids and 2 dogs and a husband, and I've been a normal GP. Not that I'm not normal now, but I've been the usual GP for 20 years, treating anything that comes into the door, including coughs and colds and cancers, diabetes, whatever that comes in. So through a personal journey on weight loss, I joined a gym, and the gym prescribed a diet on certain ways of eating, and that was a low carb diet. So I learned about low carb. I took the time to study with Low Carb Down Under, Nutrition Network, and ACNAM. ACNAM stands for Australasian College of Nutrition and Environmental Medicine. And recently, I also got myself accredited with the SMHP, which is the Society of Metabolic Health Practitioners. So I've done a bit of study. So a few years ago, I entered the low carb community, and I set up the Low Carb Melbourne with a few like-minded individuals like Tracy, Gillian Harvey, Helena Costanis, and Darren Graham. And you're most welcome to join Low Carb Melbourne. I'm part of the admin group. It's a very tight-knit group, and we're very excited to catch up every now and then. Even tomorrow, we're catching up in Templestowe. Last year, I decided to step out of my comfort zone, and as well as practicing in my usual general practice, I started my own little clinic called the Melbourne Low Carb Clinic. It's a little clinic that I do longer consultations, up to 45 minutes, and I like to dive into each patient's health. And I listen to each of the patient's health concerns, and we allow lots of time to talk about how to implement things, do things properly, and everything to do with lifestyle, including sleep, stress, exercise, mindset, all those things, as well as nutrition. So very excited. Today I had a very busy clinic, so that was awesome today. So let's start on gut health. Even back in 340 BC, Hippocrates said, all disease begins in the gut. He was so clever. Um, Even now, a lot of people don't realize that everything we do, all diseases, comes from the food that we eat. So just a bit about the gut microbiome. There are so many trillions, there's hundreds of trillions microbes in the human gut. They consist of bacteria, viruses, parasites, fungi, and there's as many as 5,000 different species. If you take all the gut bacteria and yeast and viruses, take them out of your body and put them on a scale, they weigh about 2 kilograms. So they are so many of them. There's 10 times number of microbiome cells more than the number of the whole human body, whole human cells. So it's pretty amazing that there are so many of them. There are more of them than you. Symbiosis means that we are all living in harmony, including the gut bacteria and you. Dysbiosis means there's something going wrong. So that's what we try to learn about is your body in symbiosis or dysbiosis? Back in 2016, there's a human microbiome project funded by the NIH. that try to characterize the composition and diversity and sequence the whole human gut. And it has been published in 2016. But I think we're still in the infancy of learning about the gut microbiome. There's still a lot we don't know. We're still trying to learn, and we're just in the very early stages of learning about our gut. So at the moment, we think bifidobacteria, lactobacilli species are regarded as good, and E. coli, Clostridium enterobacteriosis has been linked to disease states and symptomology. So that's what we're thinking at the moment. Then there's good bacteria which can actually release chemicals like GABA, dopamine, serotonin, and these bacteria can actually help to regulate our neurotransmitters like serotonin and dopamine and regulate our gut, our mood. And it's such a fascinating area. So what affects our gut microbiome? Obviously, the food that we eat. So if you are classified as a carnivore or omnivore or herbivore, then that affects what bacteria you have. And the gut bacteria actually changes according to what you eat. Even when we're in our infant, when we were being breastfed, or even before that, whether we're born vaginal birth or cesarean section, that can affect our gut microbiome. So we now have found that if you are born with cesarean section, the bacteria in your gut actually resembles those of the hands of the staff that delivered you. So that's pretty scary. That's the gloves, the bacteria and the gloves inside on the hands. Whereas if you're born through a vaginal birth, those bacteria more resembles those of the mum. If you're breastfed, that will have beneficial effects of your gut microbiome. And if you're handled by different people, like if you're looked after by your grandma or auntie or babysitters, if the more people you are handled, the more it affects your gut microbiome, probably beneficially. So we can't control the past on how we were born, if we were born Caesar or vaginally, but maybe we can try and advocate more on vaginal birth to our children, our daughters, or our daughter-in-laws. Then there's, on the other side, there's antibiotics, proton pump inhibitors, which are stomach tablets or antidepressants, contraceptive pill. All these medications can affect your gut. So I try very hard to not prescribe antibiotics for people who want to come in for coughs and colds, because I know that will wreck their gut and then they've got to build up their bacteria all over again. Then there's the level of hygiene, or if you've got pets like my dogs here, then all those things can affect your gut microbiome. There is some studies showing that children that are raised with pets might have less chance of allergies. And those that are living in westernized or industrialized population have totally different gut microbiome than the rural counterparts. So if you live in the country, that's a bit different. Then the level of the soil or animals or farm environment will affect it too. If you eat processed food, that might increase the risk of leaky gut. If you have individuals that are obese or lean, that can affect their gut microbiome. So there are still a lot of things that we need to learn about our gut microbiome. So these are pretty obvious. The symptoms of gut dysfunction. So if you have dental caries, reflux, bloating, abdominal pain, irritable bowel symptoms, and obviously constipation, diarrhea, passing wind, fatigue, hemorrhoids, fissures, these are symptoms of gut dysfunction. So passing wind is not normal, I've been told. And I actually found that myself as well. If my gut is happy, there's much less wind. But we've come to understand that the gut actually affects so many different departments in our body. So it affects the lungs. So there's a gut-lung axis. If you have a disrupted gut, you can increase risk of the inflammation can increase your risk of asthma or even lung cancer or airways disease. Of course, smoking increases that as well. There's the gut-brain axis. So the mood and the brain can be affected by gut disruption. The heart disease can also be increased by gut dysfunction, and you can increase the risk of heart attacks, heart failure. Gut skin axis, if you have inflammation in the gut with eating lots of sugar and processed food, it can actually reflect it on your skin. And kids like teenagers and can have increase in pimples if they have poor gut disorder. I actually routinely check on the teenagers' diet if they come in for acne and pimples or that psoriasis. If you improve your gut, that might help with your skin as well. And then we know that these metabolic diseases like obesity, type 2 diabetes, and cancer, mitochondrial dysfunction can all be affected by gut health. So to improve gut health, all these things can be improved. So everything is interrelated. Why do we care so much about our gut health? Again, the better we have our gut, the better our immunity. And we've learned a lot about that in COVID. So if you improve your gut, you can reduce the severity of COVID if you do catch COVID. Mental health, neurological health, that includes anxiety, depression, and even neurological diseases like Alzheimer's, Parkinson's. Inflammation is all interrelated as well. Last year, I did a presentation on inflammation. You can still find that on my YouTube channel. That's for Tracy's Low Carb Lifestyle Long Weekend last year. And metabolic health, that can be affected by our gut. That's to do with diabetes, prediabetes, cancer, heart disease as well. And again, cardiovascular health. So I'm going to go through a few controversial topics like the role of fiber, the role of fruit and veggies. Do we need a diverse microbiome? Do we need to eat the rainbow? What's anti-nutrients, fermented foods, prebiotics and probiotics? And lastly, how to optimize gut health. So everyone's concerned about fiber. As soon as you tell them that you're eating a low-carb keto diet or even carnivore, they ask, so what about your poop? How do you poop? Where's the fiber come from? In the doctor's group a couple of days ago on Wednesday, I actually had a doctor who said, where's all the fiber if you go on carnivore? So I looked at a few studies and we're going to pick a few to have a look at. This study looks at the common myths and misconceptions about chronic constipation. So if you look into the study, and I've got the links there, we can't assume that those people who have constipation actually lacking eating in fiber, because it might be the other way around. And some people who have a fiber-rich diet may actually have more severe constipation. And it gets worse when the more they eat fiber, the more the constipation gets worse. So I come to believe that it's actually a myth that we need fiber. I think personally that if you eat a high-carb diet, you will need fiber. But if you eat a low-carb diet or even carnivore, you might not need the fiber. This study looks at, it's a randomized controlled trial. It looks at 63 people who all have suffered from constipation. They enrolled these 63 people. 41 of those decided that they're going to go on no fiber diet. So they get rid of all the fiber. And then there's another group who went on low fiber. And then there's another group who stayed the same. All these people, 41 people who went on the no fiber diet, actually had improvement in their symptoms. Their bowel frequency went from 3 days to every day, and they reported reduced bloating and straining. So they got better with no fiber diet. And those who stayed on the high fiber diet, their symptoms were unchanged. They were still constipated and went once every 6 days. Imagine that. Oh my God. And so this study is a randomized controlled trial, the best study you can get. So let's talk about fruit and veggies and cardiovascular risk. We've all been taught that eat your fruit and veggies. That's the best thing you can have. Whenever I ask patients, how's your diet? And they go, oh, I eat lots of fruit and veggies. But is it actually important and essential? Well, this study looks at fruit and veggies and cardiovascular risk, and it's shown that it does not show conclusively that fruit and veggies protects against cardiovascular disease. So it's not, there's no conclusion that we need it, according to this study. The next study that I looked at is, this is a system review. So it means that they looked at lots and lots of articles. They actually looked at 383 articles, with 8 of them are the top randomized controlled trials. And they found that increasing fruit and veggies did not benefit from waist circumference, systolic blood pressure, fasting glucose, the HDLs, and triglycerides. So there's no beneficial effect in those people who eat fruit and veggies. So, no, doesn't help. And this one measured so they randomized 89 participants, and they took all the self-reported fruit and veggies intakes. They counted the number of serves. Those people reported 1.8 servings of fruit and veggies a day, or up to 7 servings a day. And those with more intake of fruit and veggies showed no benefit effect on insulin resistance and cardiovascular risk. And their body weight is not changed if they eat more fruit and veggies. So 7 serves of fruit and veggies has no beneficial effect compared to those eating 1 serve. So there's food for thought. Do we need fiber? Do we need fruit and veg? I've come to understand that, yeah, you can eat if you want, but you might not need it. So thank you to Dr. Suresh Kowalkar, who's the next speaker coming up. I copied his little pictures on anti-nutrients. So there's these groups of anti-nutrients, including phytates, oxalates, nightshades, phytoestrogens, and lectins. And you can find this information if you go into his Facebook group, or you can copy my diagram. And if you have too much of one of the anti-nutrients, it can actually inhibit the absorption of some of the nutrients, things like iron, calcium, zinc. They can reduce, these anti-nutrients can actually reduce the absorption of these good nutrients like iron and calcium and zinc. So just like Dr. Anthony Chaffee, who keeps telling you that plants are trying to kill you, then you just have to be careful that some plants can affect these things, like affecting your absorption of nutrients. So I don't want to tell you to stop eating all plants, fruit and veggies, but just so you're aware that in some people, eating too much of the fruit and veggies might not be that beneficial. And cooking plants can be helpful. And if you cook some of these, that might be more beneficial. So this is an article from one of the journals, not article, a table, talking about the anti-nutrients and where you can find it. So you can have a look, like lectins, you can find it in legumes, cereals, nuts and seeds, fruit and veggies. It can alter your gut function and cause inflammation. And there's oxalates, phytates, tannins, goitrogens, phytoestrogens. They can inhibit, so at the bottom, tannins can inhibit iron absorption. So if you have low iron, it might be that you're having your red meat together with your coffee and tea, or even berries that can affect your iron absorption. And these talk about how you can prepare your food that reduces the anti-nutrients, like soaking, boiling, baking. Cooking the veggies a little bit more can help to reduce the anti-nutrients. So what I'm talking about next is leaky gut. So these two diagrams show clearly what the difference is between leaky gut. So you can see on the left, the normal gut has got a nice cells all stuck together. We call the little uh, bits between the cell tight junctions because they're tightly knit together, and it's got a nice mucus layer. So it stops all the bacteria and food particles from getting into the bloodstream. And that's a nice normal gut. The blood flow has only got the nice red cells and the white cells. Whereas on the other side, if you have a leaky gut, so if your gut is damaged, causing the tight junctions to be broken, you can actually have the black particles, which is actually the toxins you can see. The toxins can squeeze in between the tight junctions. The mucus layer is disrupted. The bad bacteria can get into the bloodstream. These can be caused by things like gluten or toxins or bad bacteria or an imbalance in the bacteria or too much of the virus and cause this leaky gut. So there's actually tests you can do to check if you've got leaky gut. I must admit I haven't got much experience in organizing these tests. So there's a lactulose mannitol test that you can organize by you drink a solution which has got different kinds of sugar, that is lactulose and mannitol with different sizes. And you weigh it out and you measure these lactulose, and then you find out if the rate of absorption, how you absorb this lactulose and mannitol with different size particle. So if you have leaky gut, you might have lots of small size particle found in this urine test. So you can do this test. So just so you know, these tests are available. There's another test called the fecal zonulin test. So you can get a feces sample. Zonulin is a little fecal protein that is a marker of leaky gut. So the more leaky gut you get, the more zonulin is released. So again, you can test for zonulin. So things that can disrupt the gut bacteria is mostly the stress. So you can have stress because of foods like gluten. You can have stress because of mental stress, busyness, or even endurance, too much endurance exercise. Hopefully I'm not doing too much. Lack of sleep can affect leaky gut, processed foods, medications, like non-steroidal anti-inflammatories can promote a leaky gut, and alcohol can also increase your chance of leaky gut. So the next section of the talk is, how do we optimize our gut? How do we get good gut? Again, promoting vaginal birth and breastfeeding is fantastic. So again, we can't change our past, but we can change our future if we try to advocate in the future more vaginal birth in our daughters and daughter-in-laws, more breastfeeding that will be beneficial for our future generation. This is the low carb talk. Of course, we like low carb food. So I am big advocate of eating low carb keto diet, eating real food only. So meat, eggs, chicken, fish, that's what I always talk about. And if you want, you can eat your green vegetables, above ground vegetables, bearing in mind some people it can have anti-nutrients, not everybody. And avoid inflammatory foods. So sugar can certainly disrupt your gut microbiome, cause a leaky gut. Gluten can have the same effect as well, even though you don't have celiac disease. There's a condition called non-celiac gluten sensitivity. So there's actually a study showing that everyone who eat gluten with or without celiac, they took the biopsy of their gut, and they actually shows damages with even a little bit of gluten. Seed oil, vegetable oil, canola oil is certainly highly inflammatory and cause a leaky gut, disrupt your gut microbiome. And processed food is a big culprit, so stay away from these packaged foods. Artificial sweeteners can also disrupt your gut microbiome. So even though they're not sugars, these aspartame, sucralose, saccharin can also be not so good or even disrupt your gut microbiome. So this study, they looked at mice and human, look at non-artificial sweeteners and these non-caloric sweeteners, they can actually disrupt the gut microbiome and alter the balance of the gut microbiome. There's other studies showing that if you have these sweeteners, actually increase the risk of insulin resistance and diabetes as well by disrupting the gut microbiome. So you've got to be careful with that. With regards to erythritol, stevia, and monk fruit, the study is not sure, so you've got to be careful with those natural sweeteners as well. Then there's other foods that you should avoid is the genetically modified organism foods such as soy and foods that might have glyphosate. Processed keto foods is actually processed food, so they might have vegetables, canola oil, preservatives, natural flavorings, and alcohol can certainly disrupt your gut microbiome, cause a leaky gut. Intermittent fasting can be a very good thing to do. There's lots of studies now showing that intermittent fasting can be a good thing for improving gut microbiome. They've been tested in mice as well as humans, and it can reduce your obesity, reduce your promoting white adipose to brown adipose tissue, and it can improve your gut microbiome. And then the last study shows that intermittent fasting improves cardiovascular risk factors by altering the gut microbiome in metabolic syndrome patients. So how does the intermittent fasting help? It stimulates autophagy. Autophagy means self-cleaning, your body eating, self-eating. So body eating body. So it cleans out all the waste material, get rid of all the yucky stuff. It improves gut microbiome, especially if you do a 24-hour fast. Reduces the bad bacteria, increases the good bacteria. And if you have candida, like thrush or overgrowth in yeast, it can starve them and it can give you a chance of repairing leaky gut, stimulate stem cells, not just in the gut, but in other body parts as well. And it can reduce your craving. Lots and lots of benefits of fasting. Then there's the gut-brain connection. So the brain and the gut talk to each other non-stop. If you improve your brain, that can help to improve your gut. So the brain influences the gut. The brain controls nutrient delivery. The brain also affects the microbiome balance. The gut also affects the neurocognition, and the gut health can improve your mood. And the gut bacteria, as I said, also stimulates the production of neurotransmitters like GABA, serotonin, that goes back to the signaling of the brain. So there's different ways the gut and the brain talk to each other. There's this thing called the vagus nerve, which we call it the wandering nerve. This vagus nerve goes from the brain and it goes lots of branches to lots of different areas, including the gut. So we can change the vagal nerve and by certain things that we do, and that can help to improve your gut function. Then the gut also talks to the brain through the circulation, especially through hormones and neurotransmitters that we have talked about before. So it's fascinating how the gut and the brain talk to each other. This is a bit more about how there's differences in the gut-brain axis. On the left, you can see neuroprotection, all the cells in the gut lined up properly with a good tight junction, and the B cells and the T cells are all nicely there with the good bacteria in the bowel. So at the bottom, that's actually the good bowel. And you can see the BBB means blood-brain barrier. So all the neuron cells are intact and they're happy. The gut and the brain talk to each other happily. On the other side, there's neuroinflammation. So you can see down the bottom is the pathogen-rich status where there's the endotoxins and there's the bad bacteria and the white cells. They go between the cells, between the tight junctions, because there's leaky gut and there's gut dysbiosis. The LPS means lipopolysaccharides, which is the yucky bits coming out from the bad bacteria that's released. And it actually causes damages in the neurons. So you can actually see neuronal cell death up on the other side, and the astrocyte, which is the cells that come and clean out the bad things, they are activated. So this is neuroinflammation with disruption of BBB, blood-brain barrier. So the bad cells actually goes into the brain and causes a leaky brain. So you can have leaky gut causing leaky brain. So that's so fascinating. It can all interact with each other. So these diseases, we've actually come to realize that there's very strong gut-brain connection with Alzheimer's, multiple sclerosis, depression, Huntington's, Parkinson's, and autism. So if you improve your gut, improve your diet, we can actually improve the condition of these diseases. So fascinating. So we talked about the vagal nerve before, which is the wandering nerve that comes from the brain, goes down to the gut. If we improve the vagal nerve by improving our vagal tone, that can help with our gut function and causing more of a symbiosis, means the bacteria are happy, and less dysbiosis. So we learn to manage stress, like what Tracy talks about. And if we do some more deep breathing exercises or cold plunges, cold baths, meditation, connecting with our community, more of a friendship, practicing yoga, doing long walks in nature, like 100-kilometer, probably not 100-kilometer, that's probably too much. Singing, gargling, humming, and getting a massage can all improve our vagal tone. So doing more of a self-care things, more deep breathing, more in tune with what's happening with our body, that can help with improving our vagal nerve. Reducing medications. Again, I'm very, very cautious in prescribing antibiotics. And if you've got a cough and cold, most likely you don't need antibiotics. Taking the contraceptive pill can also disrupt the gut microbiome. Proton pump inhibitors, that's the stomach tablets to reduce acid, can also do that too. And antidepressants, and maybe other medications that I haven't listed here. So how do we optimize our gut health? If you have gut problems, there's a few things you can try to do. As I said, you can try to reduce the plants, try to reduce the anti-nutrients. You can also try a low fiber diet, count your fiber and aim less than 3 grams. You can keep a food and symptom diary and see how that affects you. And you can rate your severity of your symptoms and try it for 3 to 4 weeks. So low fiber diet may be a carnivore diet, maybe a keto form, maybe majority meat, eggs, chicken, fish, high protein, and a little bit of veggies. So you can try it out and see if that helps you. There's also evidence that a low FODMAP diet can also help with irritable bowel symptoms. low FODMAP. So the FODMAP means fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And in the table here, I've listed there's like grains and fruits and legumes and onions, wheat. Lactulose is the disaccharides like milk and cheese. Fructose is the monosaccharides, and polyols is in some of the sweeteners, fruit, vegetables. Monash FODMAP is a very helpful website. You can have a look at that. You can also look at probiotics and prebiotics. People get confused about probiotics and prebiotics. So let me explain. The probiotics are food that's got little organisms that can help to benefit the gut. So if you look at the yogurt bottle, it's got the probiotics like lactobacilli and that can, or bacterial lactobacillus, or kefir, sauerkraut, kimchi, fermented foods that's actually got the good bacteria. So the good bacteria can help to create a beneficial environment for your gut. Prebiotics doesn't have the bacteria, but is actually foods that help to feed the bacteria. So things like onion, garlic, artichokes, nuts and seeds can actually help to feed the good bacteria. This little diagram or list is actually from the Real Meal Revolution website by Tim Noakes and Jonathan Proudfoot, talking about why we need prebiotics. So they help to feed the good bacteria, they reduce the carb absorption, they can slow down the food absorption, and they can stimulate more peristalsis. Peristalsis just means the bowel working along, moving along, and that can help with the gut health. So I know 1 minute I said be careful of anti-nutrients, and another minute I said prebiotics are important with these veggies. So it depends on your condition. Some people will benefit with reduced fiber, carnivore, low fiber. Some people will benefit from prebiotics. So I'm not saying one size fits all, and you might have to trial and error and see what helps you. Then there's fermented foods, which are probiotics. So there's actually studies that looked at fermented foods compared to eating fiber. Those who ate fermented foods actually have more beneficial gut microbiome compared to those who ate veggies, like fiber. So when you choose your fermented food, make sure you have a look at the list of helpful bacteria. They should have the proper names listed in the fermented food, in the yogurt or kefir. You can also make it yourself. I haven't had much success. If you go to the shops, you can look at those that's sitting in the fridge rather than those sitting in the shelf. Like the store-bought pickles with vinegar, they're not actually fermented. They're probably okay veggies. Then there's a probiotic yogurt. You can have dairy yogurt or sheep yogurt or goat yogurt. Then there's such thing as a histamine reaction, which if you have a histamine reaction, these fermented food will actually make you worse. And so you've got to be careful with that. So I suggest you build up slowly with fermented food. So maybe one little serve first, and then build it up to 2 serves and build it up slowly. When I was doing research on this talk, I asked people, so what do you want to know? There's a few comments that asked the effect of ketogenic diet on the gut microbiome. So I did a search and found that if you eat a ketogenic diet, what happens to your gut microbiome? And I've come to a conclusion that we actually don't know. So some study says the diversity gets worse in the first 2 weeks and then it gets better after 6 months. Then there's other studies saying that there's increase in enterobacteriaceae, and other studies saying that increases in this one and decreases in that one. And some say the short-chain fatty acids help with neurovascular development. So we actually don't exactly know what the effect of ketogenic diet is. But if you go on keto, the ketones is actually quite beneficial to reduce your hunger. It helps to feed the gut microbiome, and it can be a very good thing. Then there's other things like drinking plenty of water, having lots of salt. Magnesium can be a good thing to help with the gut, and histamine may affect some people. So if you have some histamine reactions, you might have to look into a low histamine diet. I also like to look at all these other things that can help with the gut as well. So nutrition is important, as we talked about, making sure you exercise, gentle exercises, and maybe some hard exercises. Sleep can help as well. Managing addictions, managing your stress, and having healthy connections, healthy relationships can also help with your gut. The gut is so important. It can affect so many other systems. So we've come to understand that the immune system, the skin, the endocrine system, thyroid, liver, our overall health, our neurological health, our brain health, everything is affected by the gut. So I've come to an end. So I do online teaching, like the membership program called Low Carb Pro. We do fortnightly Zoom sessions, and I also run an 8-week course. You can also download my free ebook on everything about how to start a low carb lifestyle. And I thank you Tracy, for having me. There's my handles and my website.
Awesome. Let me just take that. Thank you, Avi. That was awesome, so thorough, and covered so much on the gut. So, guys, if you're watching, and because I know there's a few watching, so please put your questions in now before Avi goes. But a couple of questions I have for you. As your dog frightened me for a second when it barked.
Sorry.
That's all right. It made me jump. First of all, farting is not a sign of good gut health. I laughed when you said that, of course. But, we just don't realize that's such a common and obvious one, that what we're eating is probably not helping us. So if we do a lot of that, I mean, one of the things that I know a lot of people, find when they do change their diet is they don't do that so much. So that was good. And I wanted to ask you what your thoughts are. You eat some plants, I don't. It's very individual. But in your opinion, who would benefit the most from reducing, the plants with the lectins and all that stuff in it, and maybe looking at a carnivore type approach?
Yeah, absolutely. So I think those with irritable bowel symptoms and those who's had lots of gut problems, bloating, and even those with inflammatory bowel disease like ulcerative colitis and Crohn's disease, they might actually benefit from trialing a carnivore diet. And also those with autoimmune conditions like thyroid conditions. So yeah, I would really consider trying a carnivore diet. So yeah, I do prescribe carnivore. I ask patients that they might want to consider going carnivore and trying it for a month.
Yeah.
So yeah, absolutely.
Yeah. I think it's just one of those things that what I really got from what you're saying is there's so much involved in the gut, so many different puzzle pieces, and we just got to trial and error and experiment, and what works for some might not work for others. So the other question I had for you is how easy does our gut heal? Is it considered an easy thing? If we take out the things that damage it, does it generally heal quite well?
Again, that's individualized. So different people heal in different rates. I think the more you take out the nasty foods, the quicker it'll heal.
Yeah.
that my opinion is maybe few weeks is my thinking, but some people might take longer. Also depends on how long they've been suffering from the condition and other things like stress, sleep, exercise, all those things as well. So
Mm.
yeah, depends.
Yeah, absolutely. Sorry, I'm going to cough, so I'm just going to mute myself for a second. I don't know where the mute button is on StreamYard. There it is. I've done so well. I haven't coughed once, and now it's just getting too late, and the air's getting a bit cold. The other thing I thought, there's a couple of questions come through, but before I get to them, you mentioned processed keto foods. I'm so glad you did, because they didn't exist when I started, but they are such a normal part of people's diet. They kind of start low carb, and they look at anything that says low carb. I think it's okay. But you're right. I totally agree. If you actually turn the packet around on a lot of those products, they're full of crap. There's nothing
Mm,
healthy in it. So we're looking at the big picture, really, aren't we?
absolutely, yes. Certainly, those foods might have a place for those people who are just transitioning from a normal diet to a low carb diet. So, maybe beneficial to help them just to get through. But in the long run, those foods are full of maybe seed oil, vegetable
Yeah.
oil, fake sugar, might disrupt our gut microbiome, numbers and chemicals, things that you can't even pronounce. So I don't suggest too much of the processed keto foods. And I do see patients who are they're not moving along, they can't lose the weight and they're holding on. They think they're doing right, but they're doing these low carb keto foods. And sometimes if you examine their um, like the LDL, small dense LDL, they do have small dense LDL, even though they're doing low carb. So
Mm,
maybe those low carb keto processed foods can be doing damages.
yeah. Yeah. I agree. So Nick Johnson says, "Hey, Avi," and he also wanted to know, how do you know if you'll have a histamine reaction to fermented food? Would that be history of hay fever, etc.? So is there common side effects?
Yeah. So you get allergic reactions, allergic symptoms like hives or histamine reactions, like hay fever symptoms, runny nose, blocked nose, skin rashes, and it can be helped with taking antihistamine. So it can be to do with the foods that's high histamine. So if you search up the internet, high histamine food and low histamine food, some of the low carb food can be in the high histamine food as well, like the kombucha and fermented foods can be high histamine. So again, trial and error. You might wanna get rid of the histamine foods and see how it goes.
Yeah. Yeah. So if you had someone coming to see you who had, obviously very obvious gut symptoms, I think most people are walking around with some degree of poor, leaky gut or poor gut, given the diet that most of us are on at some point. Where would you start? Like, what would be the first recommended step? Because there's so many pieces,
Yeah,
right? Where would
yeah,
you recommend someone start?
yeah. So if you're just walking into my normal clinic, I usually start off with warning them about sugar and processed foods because everyone knows they're bad, and I don't talk about low carb or keto as yet. So first, get rid of sugar and processed foods. Then they always say, "Oh, I don't eat much sugar. I don't eat processed foods. There's nothing that I eat." Then I go, sugar's not just sugar. The bread, potato, pasta, the carbs all become sugar. They are actually little molecules of glucose molecules all linked together. So I point them to this direction that carbs, bread, potato, pasta are all sugar as well as fruit, cereal, oats. And then they go, wow, I eat all that. That's the story of my life.
And I can't give them up.
Yes, that's all the good things.
That's it. What can I eat?
Yeah,
Yeah.
yeah. So that's the usual consultation. Then I say, then you can eat real food like meat, eggs, chicken, fish. That's where all the nutrients are. So you can have the cheese, you can have healthy fat, and don't eat the crap. And I again define what crap means. Yeah. So that's the usual step.
Good start. All right. And then it just becomes, I think, for the gut, from my experience over the last 10 years, in this space, I just think you just got to keep experimenting. I think it can take a little while. There's metabolic health, but then sometimes we can get that right, but still the gut, like I know for me, there's still a few gut issues that still trying to pin down what they are. And I mean, I ate a certain way till I was 40. I mean, we can't necessarily undo things overnight. And I think it's just, we just do the best we can and try different things and listen to our body. And if it doesn't work, we try something else. And I think you've shared such great information tonight. I'd love you to end with just some final words of wisdom to everyone listening.
Final words of wisdom is never stop learning. So I keep learning about myself and the low carb nutrition and everything about nutrition and everything about medicine. And everyone can do that too.
Awesome. Well, great. I love it. I love it. Thank you so much, Dr. Avi, for being a part of the summit. And yeah, coming and sharing with us tonight like you have. It's been a pleasure.
Thank you again, Tracy. Thanks for having me again.
Thank
Fourth year in a
you.
row.
Yay. I don't know if there'll be a 5.
We'll
I say that
see.
every year. Bye.
Bye.
All right.